Not So, Little Miss Sunshine by Alexandra Chheng and Vivian Mendoza.
Description: the majority of the movie takes place in a rinky-dinky old van that travels from Albuquerque to California. The character we chose for describing our disorder is Frank Ginsberg, who suffers from major depressive disorder. Frank is a homosexual philosophy professor who got fired from his job for making poor decisions. His boyfriend left him for Larry Sugarman, the number 2 Proust scholar in the world, who received a genius grant from the MacArthur Foundation. This was the cause as to why Frank decided to commit suicide, which he failed to carry out. He is depressed, finds life meaningless, and wants to be left alone. The turning point in a story is the start of the road trip to the Little Miss Sunshine competition.
Diagnosis: major depressive disorder, major clinical depression. The symptoms include long periods of depression, extreme sadness, hopelessness, fatigue. It is considered MDD when it occurs for more than 2 weeks. The context of the film is Frank's background and what caused him to be depressed. Throughout the movie, Frank did not see a therapist. He was only checked into a hospital. But his emotions, thoughts, and actions showed that he was depressed. Depression is not diagnosed in all cultures. For example, in Asian communities, it is shameful to have a psychological disorder because it paints you as a weak person. Stigma around mental health in our culture tends to include negative attitudes and beliefs that create prejudice and leads to discrimination against individuals with psychological disorders.
Evidence: 2 symptoms Frank portrays the most is suicidal thoughts and eating more or less than usual. An example of suicidal thoughts is when Cheryl tells him, "I'm so glad that you're still here," and Frank replies with, "Well, that makes one of us." An example of eating more or less than usual would be in the beginning of the film when we see Frank sit down at the dinner table to eat dinner, but we never see him actually eat anything. Another instance is at the diner where he only orders a fruit plate and tea. A symptom he portrays less than the others is isolation, sadness, hopelessness, and worthlessness. In the movie, Frank does appear sad, but for most of it, he tries and learns to be helpful, especially to his niece who is trying to win the pageant. He shows signs of happiness even towards the end.
Treatment: if one wants to get better, they need a plan. If you have a plan, you have to stick with it. You need the support of your family, need to see a therapist to help you get to the bottom of why you are depressed. MDD is often treatable with medication, although with adolescents, it's been a controversial topic whether they should be given medicine SSRI, since it was shown that many adolescents became suicidal upon taking that medication. TADS, the Treatment for Adolescents with Depression Study, is a team that was looking for a medication that would be appropriate for adolescents, and the result was the SSRI Prozac. Our treatment plan starts with getting you to admit that you are depressed if you haven't already. Then prescribe them medication along with behavior therapy. Have them seek out a therapist, have sufficient family and friend support, eat healthy and exercise, and stick to the plan. Broader perspectives. Overall, Frank accurately portrayed a majority of the symptoms of major depressive disorder. However, viewers do not get to see Frank's disorder fully. We get a few scenes in the beginning, but there is not enough for one to judge if it was portrayed well.
Seeing psychological disorders displayed through films gives viewers a broader perspective about what disorders are, how it makes people behave, the treatments that are used, and how it affects them personally and socially.
References.